We're going to turn now to the disturbing new COVID trend across the country. About a third of Americans are in high-risk areas. That's according to the CDC. The agency's director is strongly recommending masks in public indoor spaces. We know how to do this, people. This comes as daily COVID cases are up about 26% from the previous week, and hospitalizations are up 22%. CBS News medical contributor Dr. David Agus joins us now to help us make sense of all of this. I don't know if we can ever make sense of it, David, but we're glad you're here. You know, the numbers are really very troubling. So what's causing it, number one, and how bad do you think it's going to get?
So the new Omicron variants are tremendously infectious, which is why it's just so easy to spread, so the numbers are going up. They're going to continue to go up over the next several weeks. We're seeing people who are either not vaccinated or vaccinated a long time ago get really sick, and they're being hospitalized. And that's certainly a worrying trend. That being said, we're going to live with it. We're not going to shut down. We're not going to have mask mandates. But the recommendation, when you're in a crowded place or you're close to someone, wear a mask. Please do that. Have consideration for others. It makes sense.
Yeah, it's interesting now when you're on planes, they make an announcement now as part of the warm-up to please respect the decision of the person sitting behind you, beside you, whether you wear the mask or not. Let's all be respectful of the decisions people make. But we're also now starting to hear stories of people getting COVID again. You know, there was a false belief that if I got it once and I can't get it.
I'm good.
Yeah, I'm good. But that's not happening now.
No, unfortunately not. I mean, this virus is changing literally dramatically. And so when it does that, it doesn't give you immunity to the prior strain you had. So we're seeing people who had Omicron December and January who are getting Omicron again. And so the virus is changing. It's not your immune system is bad or the vaccines are bad per se. It really is the virus is changing. We have
so
to
you're
adapt.
getting a different strain of Omicron?
A different part of Omicron, yes. So there's Omicron, BA1, BA2, BA4, BA5. All of those are different ones. And they're radically different viruses. That's why we have to keep immunity at a very high level with that booster. And we as a country are failing getting the booster. And I get the fatigue over it, but please get that booster if you're high risk especially.
Well, let me ask you, does the booster protect you from getting COVID? Because I had a conversation with a family member, and he said, I'm fully vaccinated. I've seen people that are boosted get COVID. So why do I need to get boosted if these variants are coming and they're so rapidly changing?
Great question. So the vaccines prevent serious illness. They don't prevent upper respiratory infection, which is spreading the virus.
Got you.
So you can get mildly ill if you had that booster, but what we worry about are the hospitalizations. As hospitals are filling up now, as Gayle said, we're not doing cancer surgeries and heart surgeries, and the entire country suffers as the hospitals get full, and we can't have that. So if you get that booster, you're going to have a mild cold, which is not bad. You don't have that booster, you were vaccinated a year plus ago, it could be really worse, and you could be hospitalized.
We're hearing anecdotes about people who take this 5-day course of Paxlovid after they contract COVID, and then they get a rebound case. They're only anecdotal, but what do you know about this?
It's real. I mean, and so, you know, we all know people who that's happened to. I have dozens of patients that's happened to. Paxlovid is a remarkable drug. It blocks hospitalization 95+%. But at the same time, it was very quickly developed. And probably the dose is either too low or you need a longer course, because these people get better, they test negative, and then 3-4 days later, they start to test positive again.
And that's why it's frustrating, David, because you think, I got Paxlovid, I'm good, and now you're telling that doesn't always work too?
Right, but listen, it works. You didn't get serious ill, you weren't hospitalized, but you did test positive again, unfortunately. And what we're probably going to see is some newer data to make it either a 10-day course or a slightly higher dose in some people. It's still working, but we're perfecting how it's working. And it's really important to know that 3 to 4 days later, you test positive, you are infectious, so watch out.
I'm sick of asking the question, but do you see light at the tunnel? When is it over?
I think we are seeing light at the tunnel, right? We're going back to a new normal here. And the new normal is, you know, we're going to have these spikes up and down. We're going to put masks on, take them off, but we're going to live with the virus. We're not hiding from it anymore. And that's going to continue to happen. And we have to stop the panic. Realize if we're higher risk, we need that booster. Maybe we need to, you know, if we have any symptoms, take a test and then take the drugs if we need to. But at the same time, we're not going to panic. We're not going to shut down again. We really have learned, and science is going to enable us to go forward in a positive way. But it ain't over.
Dr. Agus, thank you so much. We appreciate you.